All right. All right. So we'll just wait for a while and then we'll start. All right. So we are live now. So hi, good evening, everyone. So I'm back with another episode of the same chit chat session, that Direct Connect, the FMG show. And like we have done in the past two sessions, I've got a wonderful faculty for all of you. The one who is a role model for so many who look up to him. Sir, we want to be like you. We love you, Aditya, sir, like that. So I have with
Thank you,
me
sir.
Dr. Aditya, the one who doesn't need the introduction from my side, the pediatric faculty at DBMCI, and a wonderful, I can say, a role model to look up to for all the students who are upcoming and looking for their career in pediatrics or anyways to the premier institute of the country, the AIMS. So welcome, Dr. Aditya.
Thank you, sir. Thank you for that. Very grateful for that introduction. Thank you. Thanks a lot, sir.
So, Dr. Aditya, today's chit chat is not going to be easy for you. The things that you have done till now must have been much easier. Qualifying AIMS, doing your MD from AIMS, doing your DM from AIMS, that would have been much easier. But this session is not going to be easy for you because
Sure,
I've
sir.
got the questions from the students who are in their third year, fourth year, fifth year, final year, about to come back to India, and some of them who are, right now even preparing for the June exam. So, hi, Vaibhav, good evening. So, I'll be like telling you about this session. This session, I've got some questionnaire from the students. The basic doubts of all our FMG students who are preparing for their any of the exam, like for the June session or December or the next June, like that. So, the very first questionnaire I have for you, sir, pediatrics. When it comes to my mind, sir, I'm very afraid of it. It seems like a vast content. And I feel like it is not worthy to read that much of pediatrics because most of the part is being covered by some part by medicine, some part by ortho, some part somewhere by surgery. Sir, why should I read pediatrics? Should I actually read it?
So, sir, I would say that there is only like 10% truth or 20% truth to that statement. There is some truth. I'm not going to deny that. If that statement has come, it has come from somewhere. But the problem is, and this is something which I always tell whenever I teach in the class also, that think of pediatrics as three parts: general pediatrics, neonatology, and systemic pediatrics. Sure, you are partially correct when you say that pediatrics is covered in surgery, it's covered in medicine or things like that. You are correct only for one third of pediatrics. Okay, that is the systemic pediatrics, and in that one third also you are correct only for 50% of that. So essentially, like I said, that statement has only 20% truth. That statement has only 20% truth. 80% that statement is false. And especially from an FMG point of view, I really want to tell someone, I want to tell the students here, go through the past 5 years or 7 years papers and you have to understand the psyche of the examiner. What's their psyche? Their psyche is that, hey, you have done your graduation from a country which is not India, and now you're going to practice in India. I want to know whether you are aware of what India is and what Indian diseases are a little bit. Of course, the other part is also getting covered. What Indian diseases are. A part of the exam wants to test your Indianness and readiness for an Indian system also. And you cannot practice in India until unless you know basic pediatrics. How can you practice in India until unless you know the vaccination schedule? How can you practice in India if you cannot resuscitate a child when the child is getting born? How can you practice in India if you don't know about mumps, measles, and rubella, the basic childhood exam terms? How can you practice in India if you don't know about how a child is going to grow? That's the first thing when a 10-year-old child, before coming to an orthopedician, will first come to a pediatrician or a general physician and say, so my child is not growing, what to do? Okay, rickets, scurvy, all these things which we learn in pediatrics, the reason they're asking it is, or malnutrition or nutrition for that matter of fact, so common, especially given our low socioeconomic status, unfortunately. Malnutrition's such high prevalence, severe acute malnutrition, such high prevalence. And this is also reflected in the exam pattern also. most of the important topics of pediatrics also reflect this reality and the how you are going to practice in India. So when they say I can cover pediatrics with other subjects, they're absolutely right, but they can cover only 20% of pediatrics with that with the other subjects. So if they've done surgery or medicine properly, sure, they have covered 20, 20, 25% of pediatrics. But the general pediatrics and neonatology, they have to they have to learn about pediatrics. And more importantly, general pediatrics and neonatology take past 5 to 5 or 7 years papers. There will be at least 10 questions on them. And the reason they have those 10 questions is also amply clear. I'll be honest, sir, in NEET PG or INI-CT, maybe pediatrics is not that high a value or subject. But in case of FMG, the opposite is true. It's a very high value subject simply because of the fact, like I said, the examiner is testing your ability to come back to India, and you cannot practice even as a general physician, as a MBBS, if you don't know the basic conditions in children, malnutrition, coming with rickets, coming with scurvy, pediatric exanthem. How will they trust you as a MBBS physician if you don't know, okay, this is chicken pox or this is measles, you don't know to vaccinate a child. So this, what they say, sure, they're correct in our own way, but only 20% correct, not the 80% correct.
Wonderful thing. Wonderful thing, Dr. Aditya. So this is actually a very, very blunt statement, but a very true statement that if you don't know the basics of pediatrics, you might be a master of medicine, you might be a master of orthopedics, you might be a master of surgery, but if you don't know the basic immunization schedule, you can't be a pediatrician. That's absolutely true. So the very first message to all of you is that don't analyze any subject as if it is being covered up by any other subject. Medical science is just one. All the 19 subjects are integrated ones. At the end, you are supposed to treat one human body, and that human body has got all your departments, whether it is from the CNS point of view, CVS point of view, head and neck, or maybe pediatrics or orthopedics or OBGY. So everywhere it is just one human body with all the 19 systems. Okay, so don't even think that I am going to leave pediatrics. And Dr. Aditya mentioned very, very accurately, in the last 5 years, if you see the MCQs of the exam, there have been n number of questions on your this neonatology part. So this is not going to be covered anywhere else. Now, having said this, I do agree to you, Dr. Aditya. 100% I agree to you that when I gave the first statement, sir, I don't want to study pediatrics, only 20% is correct that it is being covered by other departments. Now, very, very clear about this part that I cannot, afford to just miss the pediatric part. But having said this, please tell me, you mentioned about the past 5 years of the questionnaires. Now, from the general, this pediatrics, from the systemic pediatrics, and from this neonatology part, which of the three do you think is the most important and from where we are getting maximum questions in the FMG examinations?
So definitely general pediatrics. First is general pediatrics, then neonatology, and then systemic pediatrics. And I'm keeping systemic pediatrics low simply because the perception of the students is partially correct. Like I said, maybe you will be able to cover and you will be able, like, if I teach about, for example, cystic fibrosis, fully possible that you might have learned about cystic fibrosis in case of as far as your medicine is concerned. And if I teach about congenital adrenal hyperplasia, you might have learned about it in OBGY, you might have learned it about in medicine also. But the general pediatrics and neonatology itself are making up around 10 questions, 8 to 10 questions easy, in which I would say 5 to 6 questions are of general pediatrics and 4 questions of neonatology. And in that sense, I would actually want to say that pediatrics becomes a very high yield subject. You would think of pediatrics as a big subject if you start taking systemic pediatrics into it. If you think of systemic pediatrics as being covered in other subjects, sure. But the general pediatrics and neonatology, nobody else is going to teach you. You are not going to learn it in any other subject. And those topics, they are very high yield topics, and they're not too huge also, to be very honest. They are like not small also, but they're not huge also, like medicine or surgery like that. They're appropriate and they will give you an edge in 9 to 10 questions easy. General pediatrics and neonatology. So maximum in general pediatrics, especially as far as nutrition is concerned, every year 4 to 5 questions related to vitamins, nutrition, malnutrition, definitions of a severe acute malnutrition are being asked time and again. Like last paper itself, I remember they asked about uncomplicated SAM. They asked about acrodermatitis enteropathica and zinc. They asked about scurvy. So these like 5 questions from general pediatrics, and general pediatrics is what? It's around 50 to 70 pages. So it's very high yield also. So if your mind is that I don't want to do pediatrics because I'll cover it in other subjects, I'll give it to you that. Sure, do that. But don't ever think of leaving general pediatrics and neonatology. If you think about leaving general pediatrics and neonatology, or you are putting 10 easy high yield topics and 10 easy questions on the lines, which you easily would have marked correct. Minimum 10, I'm speaking. If you take the last paper specifically, it actually had increased to 15. Minimum 10, depending upon the mood of the examiner, can be as high as 15 also. So easily close to 10% of the syllabus. So it's, and 10% being covered in 2/3 of a subject. So that's what I'm saying. It makes it a very high yield subject, especially as far as FMG is concerned.
So now two very, very important messages for all of you from pediatric point of view. There are two most important things what Dr. Aditya just said. Number one, if you are smart enough to understand what is overlapping in your medicine part or surgery part or pediatrics part, if you are smart enough to understand that, and if you are intelligent enough, or you can say you are decent enough to understand the topics from your medicine side and surgery side, then only you can afford to leave that systemic part which is overlapping with the other subject, right? But here you have to be very, very smart enough because a small mistake will land you up in a big trouble. Second statement he said is these 10 questions are those MCQs which can be easily and very accurately marked in your exam. And you know very well that MCI screening exam is actually a screening exam only. A 300 question paper where you're allowed to do 150 mistakes. But having said that, it doesn't mean that you are supposed to do 150 mistakes, right? Even 1 mark short, 149, is the most painful mark I can tell you, which we see in the scorecard. And that only happens when you just try to leave a subject, leave one of the most important part of the subject or the topic of the subject, which you know is a very high yield one, which you know is a very easily scoring one. So do not think about leaving a subject, right? And if you have got a wonderful schedule where
Definitely.
you know what all integrations. Yeah, please, Dr. Adit, you saying something.
So
Please.
that's what I'm saying. That if you are if you like absolutely right, if you're smart enough and you can understand that systemic pediatrics is covered somewhere else, sure, save time and revision and everything. I'm perfectly fine. But general pediatrics and neonatology, if you are leaving 10 questions on the table. Minimum.
Absolutely.
Minimum 10 questions on the table.
Minimum 10 questions.
And
Absolutely.
can be as high as 15. So in the worst scenario also, it's my sincere request. Please do general pediatrics and neonatology.
Perfect. Perfectly said. I do 100% agree to that, and there is no argument even on that. Sir, can I leave neonatology? Can I leave the basic of the pediatrics? No, not at all. Simple
Not
answer
at all.
is no. Right. Now, having said this, Dr. Aditya, see, I am a student who is not able to understand pediatrics because maybe some reason my college is not having that good pediatric department. So pediatric videos are too vast, and I am not able to, cope up with so vast videos of medicine, surgery, OBGYN, and pediatrics also. So can I, instead of looking at the whole pediatrics, can I just simply go to the rapid revision videos and complete pediatrics from that? Is that a good idea?
So, only for systemic pediatrics, I would say you can consider it if your medicine and surgery is done, not for general pediatrics and neonatology. Again, I'm telling you that if you divide, let's say there are 40 hours of main videos and you are thinking 40 hours is too much. But if you take, like I said, general pediatrics and neonatology are very high yield also. If you take the part of general pediatrics and neonatology, that will only be 15 hours, which is equivalent to the amount of there is in rapid revision. So the smart student, what he can do is he can do surgery, medicine, and OBG properly, which he should, because if he's not doing that, he's not even in the race, to be honest. If you're not doing the three main subjects, that is OBG, surgery, and medicine, then what's the point of giving the exam in the first place, right? So when he has already done those three subjects properly, and now he feels, let's say he feels, I'm not saying he should, but let's say he feels there's a lack of time. Even if there is a lack of time, if you do general pediatrics and neonatology, they are 15 hours. Why do you want to do 7 to 8 hours of rapid revision? Do 15 hours properly, 5 extra hours. And maybe for systemic pediatrics, you can cover it in the 2-3 hours part of the rapid revision. So instead of the 35 to 40 hours of main videos, suddenly they have shrunken down to 14 to 17 hours. And still you are essentially getting all the questions of pediatrics correct.
So now when you're saying this, Dr. Aditya, does it mean that if I, let's say, I'm trying to simplify, but Aditya sir told me that you have to go for 15 hours of this main video. So can I take it like that? I should be taking out the factual points from it? Is
No, no,
pediatrics,
you
is
have
this
to
systemic
understand.
or neonatology?
No,
Yeah,
no, no.
please,
So
please.
the entire point of a main video is that it will give you logic rather than just facts. The entire point of going through a little more, if you just wanted facts, then you could have gone through the 7 hours or 6 hours of rapid revision also, right? But the entire point that I'm saying that instead of going through 7 to 10 hours of rapid revision, a little extra effort, not something extraordinary. I'm asking you to go through 14 hours of main videos of general pediatrics and neonatology, because those 14 hours will cover the most essential parts of pediatrics, and they will cover not just facts, they will essentially cover the most important concepts related to pediatrics. Okay. And at the same point of time, like I said, for the systemic pediatrics, which is there extra, if you have done your three main subjects properly, for that, if you really want, like, shortcuts are never advised, but yes, if you are literally very short on time, then maybe for this particular portion only, systemic pediatrics, you can consider rapid revision if, and it's a very big if I really want to emphasize again, if your medicine, surgery, and OBG is done.
Absolutely, I do agree. So no shortcuts,
No
only
shortcuts.
concepts,
Yeah.
main videos of the general pediatrics as well as neonatology.
Neonatology.
Systemic only if your medicine part, your surgery part is good, then only. Otherwise, consider pediatrics again as a very, very important one and consider all subject for that fact as important one. All right.
And I would say that if you look at it from this perspective, that 14, 15 hours are giving you 10, 15 questions, then suddenly you will realize how high yield pediatrics actually is, especially
Absolutely.
as far as
Absolutely.
FMG is concerned. That why do you want to take a shortcut of doing 10 hours of rapid revision? Well, the essence can actually be done in 17 hours also, right?
Absolutely.
Just a small extra 1 day or maybe 1.5 day extra effort, and you will actually be able to get concepts also, facts also, and 15 questions correct in the exam also.
Perfect. Now, I just want to ask you one very important thing here. Please tell me when you are saying so much about pediatrics, now I'm getting more and more attracted towards pediatrics. Sir, I'll not leave pediatrics. In 15 hours, I'm getting 15 questions. What can be better than this? But now, can you please tell me the most important topics that you want me to focus upon for my FMG examination?
I would say, sir, nutrition. The first and most important is nutrition, because it's a conceptual topic also, and it's a very high, like 5 to 7 questions on nutrition are already there. In neonatology, especially if I consider neonatology as a subset, in that respiratory system disorders, both in neonatology and in general in systemic pediatrics, becomes very, very important. And at the same point of time, I would also like to emphasize upon genetic disorders, especially genetic disorders. 1 or 2 questions on genetic disorders are being asked very, very frequently. These are the topics I would say you should definitely consider. Uh, and last, I would say is milestones. Milestones is a little, I'll be honest, sir. This is something which I say in my class always. Milestones do have a concept, but there are certain things in medicine which unfortunately you have to kind of memorize only after a point of time. So think of milestones that you understand the milestones 2 months or 3 months prior to the exam. There are 4 tables of milestones of gross motor, fine motor, language, and social. Put it in your 20th notebook and ensure you revise it 1 day prior to the exam. And you'll at least get those 1, 2 questions of milestones correct. So nutrition, milestones, in neonatology specifically, the respiratory system disorders, genetic disorders, and in systemic pediatrics also, the IMNCI management system, again the respiratory system disorders, broadly I would say, along with diarrhea. I mean, anyway, when IMNCI comes in, like I said, sir, if you think about pediatrics from the sense that you're going to practice in India, suddenly you yourself will be able to recognize the important topics. Why are they asking IMNCI management? Because they are expecting you to man a primary health center. Why are they asking about diarrhea management from IMNC? Again, because they're expecting you to man a primary health center. Why are they asking about nutrition? Because again, the management of SAM is done in a primary health center. Why are they asking specifically about respiratory distress disorders in neonates? Because when neonates, they're not able to take, after birth, the most common disorders are respiratory disorders. So if you just think from that line that I'm going to practice in India, I'm coming back to India after completing my graduation from somewhere else. Even in this vastness of pediatrics, you will be able to identify the high yield topics. If you think it is vast, I personally feel that if you do general pediatrics and neonatology, focus on that properly, it won't seem vast also. But even if you consider it that way, a slight focus there, you will be able to recognize important topics and revise them in a more efficient manner.
So broadly, the crux is as a student, don't think of the exam as a student, think as a physician.
Physician.
What all common problems you are going to see in the
Exactly.
community, what all troubles you can see in a newborn baby or maybe in the developing child, and those
Mhm.
are your high yield topics. Perfectly said. Now, having said this, now when you are telling so much about the pediatrics, the most important topics, now how much is the importance you think one should give not only to FMG PYTs, First of all, it is the PYTs or the PYQs,
So it's
and is
obviously
it
it's all.
only about the FMG or NEET or INSET also?
So, sir, maybe 3 or 4 years ago, you could have said only FMG. Maybe 4 years, 5 years ago, you could have said that. But if you look at past 3 to 4 year papers, the trend has changed. Now it is NEET PG. Now it is a little bit of, especially past 2 or 3 papers of INICT also, I would say that they should at least give us GT to get an idea. But definitely the level of FMG has elevated. It has become similar to that of NEET PG. So you can't say that I'm just doing FMG and I would, I would be very comfortable. If you want to get into a comfortable territory that I'm going to pass in a very comfortable manner, then you have to expand your level a little bit more towards NEET PG. This has definitely happened. This has definitely happened over the past 2 3 years. If you want to pass, sure. If you really want to get exactly 150, maybe just the FMG PYTs might suffice. But that will not be comfortable passing. That will always keep you so anxious. It will keep you up at nights that my GT scores are always between 145 to 155. That's not a happy state to be in. Sure, you might pass, but you might give yourself a hypertension. You might give yourself some problem. Be in a little more comfortable position. Be yourself. Be a little more comfortable. Just a little bit extra. It's not nobody, and it's not that the chasm between FMG and NEET PG is too huge.
All right. So I guess everyone, Dr. Aditya got his internet connection disturbed. That's absolutely all right. So what he just said, I'll just rephrase for all of you. See, understand in the FMG exam or the NEET exam or the INSET exam, you are nowhere supposed to leave a subject. That is the first message. And this is very, very important for all our students who are yet to come back to India. बेटा जब आप लोग बाहर हो ना, एक बहुत ही बड़ा मिसकंसेप्शन आप लोगों के दिमाग में इतना ही पढ़ लो हो जाएगा. That इतना ही पढ़ लो is the most disturbing and the most destroying line. Right? इतना ही पढ़ लो का क्या मतलब है कि क्या वही पेशेंट आने वाला है आपके पास में? Is that the single patient who is going to come to you कि इतना ही पढ़ लिया? उस पढ़े हुए के अलावा अगर पेशेंट आ गया तो क्या बोलोगे? पढ़ा नहीं था इसलिए देख नहीं रहे, right? Any of your exam, whether it is FMG, NEET exam or the INSET exam, they are all your clinically oriented exam nowadays, right? When you're talking about the clinically oriented exams, you have to understand what is the meaning of this. The kind of patients you are going to get in your OPD, the kind of patients you are going to see every routine of the day. Like, for example, yesterday, me and Dr. Aditya, we were taking a session of ortho and pedia, the integrated one, right? When you talk from the metabolic disorder point of view, you read so many topics. You read rickets, you read scurvy, you
Sorry,
read OI. Yeah,
sorry,
Dr.
sir. I
Aditya.
just
No, no
back
worries.
again. 1 minute.
Yeah, yeah.
Some there
Please,
was
please take your time.
some. Yeah. No. It's okay, sir. Just something
Yeah.
happened.
So
I
there
don't
was
know.
just
Some internet connection was lost. Yeah.
that's
So
that's nothing in
yeah.
your hand.
Yeah. So I
So
was
I was
saying,
just
sir, I
telling
feel a
them,
lot of FMG students. I was on the last time I was taking was that FMG students I feel are a little. I would say they feel a little underconfident. They shouldn't feel that. You are doctors. Is this an is after all an exam for simply to come back and practice in India? You are doctors. You have gotten that degree. Don't think of yourself as don't be underconfident. Don't be feel like okay मेरे को इतना ही करना है because मेरे को ये बस एग्जाम पास करना है. नहीं यार तुम डॉक्टर्स हो. कल को तुम्हारे पास एक पेशेंट आएगा तुम उसकी जान बचाओगे. You have learned that. You are graduates. You are not someone. Just have a little bit emphasis for that word doctor, a little respect for that word doctor, and study a little bit more. Be in that comfortable zone. If you want to be in the comfortable zone, just a little bit of NEET PG extra topics, and you will get from that 145 to 155 की जगह तुम 170 180 के comfortable zone में आ जाओगे. It's not too much extra effort. It's just maybe 1 hour extra on a daily basis for 6 months. उतना हल्का सा एक्स्ट्रा कर दोगे ना बहुत खुशी मिलेगी. खुद को भी मिलेगी एग्जाम भी खुश होके दोगे एग्जाम भी much higher chances of clearing. That is all I'm expecting from FMGs. And it's not previous year question. Exact previous year questions are not repeated. It's always the previous year topics. So the previous year topic is SAM. So if they have asked you a question on what is the management of SAM or what is the definition of SAM, the next time they will ask you something like which of the following is not under the definition of SAM or which of the following does not come under the definition of acute malnutrition, which comes under chronic malnutrition. So the broad topic is staying the same. They won't suddenly ask you a random, disease. If they're asking you about cystic fibrosis, maybe one time they will ask you about the most common mutation. The next time they might ask you something related to management. But they won't suddenly ask you a rare disease of the respiratory system. It's the common things, the common high yield topics. They will keep on asking questions. here and there related to that. The exact question might not be repeated. So I know a lot of people what they do. Okay, cystic fibrosis, most common mutation delta F508, option B. मैं ऑप्शन बी याद रखूंगा, वही आने वाला है. अरे ऐसे थोड़ी ना होगा, तो सिस्टिक फाइब्रोसिस पढ़ना है, थोड़ा सिस्टिक फाइब्रोसिस पढ़ना है. A lot of people unfortunately do that, but you just need to do the topics. Just simply by doing the topics also, you are, I would say, you are making sure that your preparation is in a focused and high yield manner. आपको ऑलरेडी पता चल जा रहा है कि इतने ये वाली जो चीजें हैं ये इतनी इंपॉर्टेंट नहीं है. हमने पढ़ लिया है, गॉटन द ब्रॉड कॉन्सेप्ट, मे बी दे आर नॉट दैट इंपॉर्टेंट, उनको रट्टा मारने की जरूरत नहीं है, मे बी आई डोंट नीड टू रोट मेमोराइज देम. बट जो ब्रॉड टॉपिक्स हैं वो तो सेम ही रहते हैं सर. 70 to 80% क्वेश्चन ब्रॉड टॉपिक्स सेम ही रह रहे होते हैं. अब इफ यू, मतलब आई बी ऑनेस्ट, इफ समवन इज सेइंग कि मैं सिर्फ पीवाई क्यूज करके उसके एग्जाम ऑप्शन को रट्टे मार के चला जाऊंगा, सो देयर आर टू प्रॉब्लम्स विद दैट. एक तो तुम खुद को झूठ बोल रहे हो, you're not being honest with yourself. You are looking for the biggest shortcut. We have given you the shortcut. That PYTs themselves, if you look at medicines are infinite, but doing PYTs, that itself is a good short. I'm not saying it's a shortcut, but that itself is a good focused way to learn. You already are there. अब उसमें भी shortcut लगाना है, फिर थोड़ी ना होगा यार.
Absolutely, I do agree. What you're saying is absolutely right. So when you just got disconnected from the internet, I was telling them the same thing. Like what you said, I was just telling them same thing. देखो एक चीज सबको याद रखनी है, that when you are away from India, when you are in your third year, fourth year, fifth year, so एक लाइन ना बड़ी common है. I've been traveling recently to various countries, and I've been meeting n number of students, and what I come to know is when they tell me, sir मुझे किसी ने बोला है बस इतना पढ़ लो इतने से हो जाएगा, राइट? सो बेटा समझो, दिस वर्ड डॉक्टर कैरीज अ बिग बिग वेटेज. यहाँ पे ना इतना पढ़ने से इतना नहीं हो जाएगा. दिस इज द मोस्ट, आई कैन से द वर्स्ट लाइन आई हियर फ्रॉम अ मेडिको कि इतना कर लो हो जाएगा. पेशेंट क्या आपको ये बता के आएगा कि सर जो पढ़ा था मैं वही वाला पेशेंट हूँ, जो नहीं पढ़ा था उस पेशेंट को हम देखेंगे नहीं. इट इज नॉट गोइंग टू हैपन. दैट सर इतना कर लेंगे, तो इतना कर लेने से वन लाइनर्स आ जाएंगे, वन लाइनर हो जाएगा, रट लेंगे, हो जाएगा. इट्स नॉट गोइंग टू हैपन. यू आर गोइंग टू बी डॉक्टर्स. I always tell all of you, like I'm repeating the same words. These MCQs are not questionnaires, these are your patients. And patient can be in any form, any way. A patient of orthopedics may land up into ICU, become an anesthesia patient, right? It has to be managed by the team of anesthetists plus the orthopedician. Fat embolism syndrome, medical fellow has to be engaged, right? So you cannot have that fracture shaft of femur means shaft of femur. A orthopedician alone is going to manage it. It's not going to happen. It's a teamwork always. And we should be always prepared for that. That my OBGY patient who came for a normal delivery, went into cesarean for some reason, went into PPH, went to ICU, went to medicine department for something. So multiple departments have to be involved. So don't have this thought in your mind कि इतना कर लेने से हो जाएगा. Doctors बन रहे हो, right? Shortcut नहीं चलेगा. And patient will never come to you with a label onto himself कि सर मैं तो ENT patient हूँ, बस ENT का ही प्रॉब्लम है, मेडिसिन है बस मेडिसिन वाला देख लो. ऐसा नहीं होगा, right? Second thing is, always remember when you are, Sarvesh was saying, so Sarvesh, I was saying this thing only, never leave a subject, never think of leaving a topic or subject. एक घंटा, Dr. Aditya said a very very important word and a line, if you have been able to catch it. See, when you are in your third year, fourth year and fifth year, आप उस मौके को आने ही क्यों दे रहे हो? व्हेन यू आर कमिंग बैक टू इंडिया, यू लैंड अप एट इंडिया, एंड यहाँ लैंड करने के बाद समझ में आता, ओ शिट, सिर्फ 4 महीने और बचे एग्जाम के लिए, तो कुछ हो ही नहीं सकता, अब तो बहुत ट्रबल होगा, बहुत मेहनत करनी पड़ेगी. इफ यू रीड जस्ट 1 hour पर डे फॉर योर एग्जाम, एंड दिस इज नॉट फॉर योर एग्जाम, दिस इज फॉर योर नॉलेज. 1 घंटा रोज पढ़ोगे ना, तो महीने के 30 घंटे होते हैं, राइट? एक साल के 365 घंटे होते हैं. एंड इफ यू स्टार्ट विद द थर्ड ईयर फोर्थ ईयर, you are already studying for 700 hours, 1000 hours, and that is more than enough to crack any of the exam. सिर्फ 1 घंटा ही तो चाहिए. और वो आके अगर आप पढ़ना चाहते हो इंडिया में वापस 50 घंटे, 60 घंटे, 100 घंटे, 200 घंटे, it is going to be pressure on you, right? So you have to decide, you want to build a strong foundation, or you want to just go randomly and come back here and feel the pressure. बाहर रहते हुए प्रेशर नहीं समझ में आता, बिकॉज आपके सामने वो बैच ही नहीं होता जिसने एग्जाम दिया है. जब आप इंडिया लौटते हो, अपने सीनियर्स को देखते हो, those who have qualified, they become a source of inspiration for you, right? But the real source of inspiration should be those who have actually tried but unfortunately could not qualify, because they are the biggest lesson givers to all of you कि मेरे से गलती कहाँ हुई, right? So if somebody has already done a mistake, learn from the mistakes. Why you want to do the same mistake and then say अच्छा अब मैंने भी सीख लिया. Okay, so be the smart learner who starts early. Like I'll tell you, somebody just asked me just today only that, sir, I am in fourth year, I am in fifth year, and I am just appearing for the exam of June 26. Right? One of the student was for December 26. Okay, so what are the plans should for myself? What should be my schedule? So I just tell everyone, it's keep it very, very simple. Take schedule of anyone. If you want to take the schedule of DBMC FMG, we can share that with you. Right? Any student who's preparing for June, they are already with us. Those students who will be going for December exam, you can start preparing from today. Still, we have completed PSM just now, yesterday. Today was the leave, and today we had a small session of medicine, right? And tomorrow there is going to be a post-class test, and after that we are going to start again with medicine. Medicine will be followed by microbiology, that will be followed by other subjects. So we still have 7 subjects coming up. So those who wish to start early, appearing for the December exam, they should do it right now, right? Start making the notes when you're in your college. Start making the notes, take the PDF, learn with the faculty. They're telling you the concepts. They're building your foundations very, very strong. Once you're back to India, out of 19, your 7 subjects will be completed, right? 50% broadly is completed. And then you are going to revise those 7 subjects and you are going to read the other 12 subjects or 13 subjects. That way, you have to take an extra step. You have to be always not hardworking. It has to be a smart work, right? And this is what the smart work says. I do little every day, or I do too much in a day, which I cannot handle. It's up to you, right? So smart karo, in MCQs, beta will take that point. I'll ask this question from Dr. Aditya, but this is the message which Dr. Aditya gave and which I also second, that this is how you have to start. And those who wish to know that what all subjects are pending right now for the June session, and those who are coming back to India, please fill up the form which is there in the chat section. You can fill the form and my team will be in connect with you, giving you all the details that how we conduct the classes at Delhi, how we follow your post-class test, how we do the post-class test discussion, how are we planning your round one, round two, and all those academics. And I'm telling you, this academics is going to force you to be on your toes and to qualify your exam in the very, very first go. Right? So just fill the form and team will be connecting with you. Dr. Aditya, one very, very important question. If you are studying every day, then how to solve the MCQs? Right after reading the topic same day or after week? What do you suggest?
Daily, sir, obviously daily. You have to do MCQs, a little bit of MCQs daily. So you can basically वो हैबिट बन जाएगी ना एक एमसीक्यू सॉल्विंग जो बोलते हैं ना एबिलिटी देयर इज समथिंग कॉल्ड एज एमसीक्यू सॉल्विंग एबिलिटी दैट विल ओनली हैपन इफ यू सॉल्व क्वेश्चंस ऑन अ डेली बेसिस so let's say you are completing pediatrics over 1 week. I'm taking an example. So on the first day, second day, let's say you did not do on first day itself, for example, but by 2 days you would have done general pediatrics. Solve general pediatrics MCQs. Next 2 days, you would have done neonatology, solve neonatology MCQs, then you would have done systemic pediatrics, solve MCQs. There's no point of doing 1 week of pediatrics and towards the end of 1 week, then doing all MCQs, starting from general pediatrics to the end of the systemic pediatrics. No, that's not the point. Whenever you're completing with a topic, ideally, you should complete some topic on a daily basis. But even at least bare minimum, I'm saying that every alternate day, you should start practicing MCQs. And when you're done with the test, then MCQs are done and then do give one subject-wise test. That kind of seals the deal as far as that particular subject is done. And by the time you're done with 4-5 subjects, I would say you should, when you're done with, I would say 30% of the syllabus, 25%, you should start giving GTs. Doesn't matter you are not doing well in those GTs, but you have done 25-30% of the syllabus. See how a 200 question paper, a 300 question paper of the entire 19 subjects feels like. Start giving that. No harm in, a lot of people say, number kam aayenge. Sure, I know 100% number kam aayenge. But that's not the point. The point of giving that paper is to endure 3 hours of MCQs continuously. You will get into the habit that how to sit for 3.5, 6 hours to give the MCQs properly. वो important है. आपको वो आदत बनानी है कि एक बैठ के MCQs कैसे लगाने होते हैं, वो एक आदत बननी पड़ेगी. So that on the exam day, it doesn't feel like a core. It doesn't feel like I'm doing this for the first time. So there are two parts to MCQs. One is the actual MCQ solving, and another is the feel of giving MCQs and feel of giving an exam. That will only happen when you start giving GTs, and you don't need to start when you're done with 19 subjects or 18 subjects. No, start after 5 to 6 subjects itself, I would say. And after every subject, do that subject wise, solve MCQs on a daily basis, and then one subject wise test towards the end. Frankly, this much is enough. It's not too much also. And don't be scared of it, most importantly. A lot of students I personally feel are, especially in the FMG segment, are just scared कि हो नहीं पाएगा. अरे करके तो देखो, 100% होगा. क्यों नहीं होगा? Don't underestimate yourself. You guys are as brilliant as anyone here. You guys are just underestimating yourself. You guys are doctors. Don't underestimate yourself. Have that little bit of confidence. What's the worst? उस एग्जाम में ये GT में नंबर कम आ जाएंगे. What's the worst that can happen? The GT gives you bad marks. But is GT the actual exam? No. The entire point is you make all the mistakes now so that you don't make the mistakes in the actual exam.
Wonderfully said. So एक बात I would like to add here. देखो अंडर एस्टिमेट करने का ना कोई पॉइंट नहीं है. यू ऑल आर नाउ द नीट क्वालिफाइड स्टूडेंट्स.
Yeah,
है ना, मेहनत की है, नीट क्वालिफाई किया है. Unfortunately, for some reason, you are not in India. That's absolutely okay.
exactly.
And I am telling you today on the open platform, 5 years down the line, 10 years down the line, people will simply ask you कि सर मुझे बचा लोगे, मुझे ठीक कर दोगे कि नहीं कर दोगे. Nobody is going to ask you कि सर आप कहाँ से थे, कितने बार में पास किया. Now, the most important thing, solve questions every day. You all must be very much aware about the change in the trend of the paper. It is not now 300 questions in 300 minutes. It is 50 questions in 50 minutes. 6 sessions of the same thing, right? And you have to be quick enough to read the clinical scenarios. It is no more a one-liner. It is no more the rectification. It is no more the mugging up of things. You have to be so quick that your eyes and mind are so coordinated that you catch up the questions very quickly from the questionnaire and you reach out to the diagnosis, whatever has been asked to you. Once you submit 50 questions, even if you're not able to submit, it is going to have auto submission. Now you cannot go back. So these questionnaires, which you practice every single day, they will make you so strong that my mind is only focused upon what I have in front of my eyes. I'm not getting distracted by the previous question. I'm not thinking about the second question, which is about to come next. In exams, it always happens. It will happen for sure. Every 300 questions, you can't just mark correctly, right? So it will happen that there might be a question which is wrong, which you know, which you don't know. There might be another question which you know, again, you are not aware of it. Third question, it might happen, you are not aware of it. But then that should not be so disturbing for you. That fourth question, which is a straightforward factual thing, which you know, you're marking it wrong. So these tests are your practice matches. And you all know you cannot go to the World Cup directly without playing the Ranji, matches, state level matches or the national level matches. For the World Cup, you have to prepare well, right? So give the test prerna every single time. All right. So now, Dr. Aditya, coming on to this, I am very much convinced that pediatrics makes a very important part. Minimum 10 to 15 questions. Systemic, you should read from the integrated part if you're smart enough to make it out. General, pediatrics plus neonatology, very, very important. Always the main videos, right? And no shortcuts, always the concepts. PYTs of FMG are definitely important, but equally important are your NEET PG PYTs and some at least INI PYTs as well. All right. So now one
Two
very
papers, 2 to 3 papers of finance.
papers, or you're saying
2 to
years?
3
Because
papers
I
of
understand
INIC.
papers. You're
Two,
saying all right.
3 papers. At least you actually what happens is, sir, that it gives them an idea of a slightly higher level so that they're more prepared on the actual day exam.
Perfect. Perfect. Now, one very important thing which I often get in my inbox. Sir, I am reading from platform A. I have taken the notes of somebody from DBMCI. He has been my senior or somebody. So Aditya sir has taught there. I am having my this plan of somebody, some app. But anyhow, the notes are too bulky in my app. I took the notes of Aditya sir or faculty B or faculty C of this particular subject. Should I change my source? I am not very happy with my source, but I am very much worried that I have invested so much time in making my own notes, which I'm not able to read well, and I'm not able to solve the questions from them. So is it a good idea to change my source? Can I do it now?
This is slightly controversial, sir. I would say that while I would say, sir, while changing of source is never recommended, there are two parts to it, sir. And people actually, the point is that people are not able to understand the nuance of it. The problem is, let's say you did something from XYZ source, you're not able to revise it. You see my notes or you see someone else's notes, for example. The first fundamental problem with that is you will not have the photographic memory, or you will not have the idea about key. There will be a mismatch between content, style of content, the way the content is written. Okay. And as a result, the other set of notes itself will become tough to remember. So that is why that changing of source is not recommended. Having said that, and this is a very important but I'm going to say, but unfortunately, most people are not able to understand that this nuance. What you can utilize is that from this your own source, which you have already done, which you are already thorough with, sure, you're not able to revise it. That is your problem, right? That आपसे रिवाइज नहीं हो रहा, अभी आपसे रिवाइज नहीं हो रहा, आपको ये दूसरा सोर्स दिख रहा है, आपको छोटा जरूर दिख रहा है, पर आपको ये समझ नहीं आ रहा, you're not able to understand it because it is not in that style. It is not, you have not read from that primarily. The best would be, if you feel like, if you cannot revise from it and you feel this is concise enough, make your own concise notes. Maybe use it a little bit as a reference to just guide you on how to make your own notes. But use that primary source that you have actually used initially and उससे खुद के concise notes बना लो. इसको एक हल्का सा, अगर तुम्हें लगता है दूसरा सोर्स कंसाइज है, मेरे को शायद रिवीजन में हेल्प कर देगा, रिवीजन में तभी हेल्प करेगा ना, इट विल ओनली बी एबल इफ यू हैव फोटोग्राफिक मेमोरी ऑफ इट. इफ यू सडनली स्विच टू दैट, यू विल नॉट बी एबल टू रिवाइज. सो आई वुड से यूज इट, मे बी यूज इट एज अ गाइड बुक, अ गाइड की क्या क्या रिवाइज करना है, क्या क्या इंपॉर्टेंट टॉपिक्स है. बट खुद जो मेन सोर्स पढ़ा था उससे अपने खुद के कंसाइज नोट्स बना दो. इट इज गोइंग टू टेक मे बी अ डे और टू ऑन द हायर साइड, बट डू दैट एफर्ट. For that purpose, maybe those notes are a little bit of a guidance. They are just guidance. But if you suddenly switch from this to that, then you are going to be in trouble. I would say stay here, use it maybe a little bit as a guide to make your own concise notes from your own primary source that you have already done.
Perfectly
But
said.
I would
So,
not say that, the problem is that what people end up doing, that's why I'm saying, sir, कि प्रॉब्लम ये है कि जब ऐसे हल्का सा ये चीज समझ ही नहीं पाते, वो कहते हैं अच्छा सर तो ये कह रहे हैं ना, वो कर लो. नहीं, वो नहीं कह रहा. उसको थोड़ा गाइड की तरह यूज कर लो, पर खुद के नोट्स बना लो फ्रॉम योर ओन सोर्स, ताकि आपको उनकी फोटोग्राफिक मेमोरी भी हो जाएगी, बिकॉज दे आर इन दैट स्टाइल व्हिच यू हैव रेड, एंड दे वुड हैव बिकम कंसाइज आल्सो. सो मे बी जस्ट फॉर कंसाइजिंग यू कैन कंसिडर यूजिंग दैट. That's about it. The similar ways of first aid also works. Like I always promote first aid, but first aid कोई भी, no matter any person who is using it in FMG also, and for that matter NEET PG also, nobody goes directly to first aid, sir. लोग पहले अपने मेन नोट्स पढ़ते हैं, फिर फर्स्ट एड देखते हैं, एंड मेन नोट्स के इंपॉर्टेंट टॉपिक्स को फर्स्ट एड में एनोटेट कर रहे होते हैं, ताकि फर्स्ट एड उनके हिसाब से बन जाए. एवरी पर्सन फर्स्ट एड इज यूनिक. आपको अगर यही यही सिमिलर फॉर्मूला आपको यहाँ पे अप्लाई करना है, इफ यू वांट टू. अगर आपने खुद ही कंसाइज नोट्स बना लिए हुए हैं, देन व्हाई डू यू वांट टू बी इन अ फियर ऑफ मिसिंग आउट ऑफ सम अदर पर्सन्स नोट्स? फिर उसका कोई पॉइंट ही नहीं है. This is what I want to say, that you maybe you can use it as a guide, but don't shift to that. You will not be able to understand. It's not in that flow, it is not in that style, it is not in that photographic memory that you have. Use it as a guide to make your own concise notes, which you can revise multiple times and hence have a better memory and better recallability as far as exam is concerned.
so guys, two important lines, very, very important one. The best books of the world are written by the author himself. Remember this, right? आपकी अपनी लिखी हुई book, आपके अपने लिखे हुए notes are the best things that you have, because you always have that photographic memory where you have written what content. So improvise upon your own handwritten notes. So if you have time, if you are a third year student, fourth year student, fifth year student, and still have time to go for the exam, start preparing your own notes. There is nothing better than that. And don't get too much attracted towards the source A, source B, source C, source D. Have five sources, that's okay. But then you should have your own concised material, because ultimately it is the revision which is going to work, right? I am not becoming a specialist of pediatrics today. I'm not becoming a specialist of medicine today. I should be knowing something about everything. And that something is actually the concept and basic of the medical science, right? So always don't get carried away that my friend is reading from this thing, उसने इससे पढ़ा, मेरा कंटेंट ज्यादा है, उसका कम है, उसमें शॉर्टकट कर लेते हैं. नो शॉर्टकट्स. Okay, so medical science में शॉर्टकट कभी काम नहीं करेगा. So remember that. So wonderfully said.
तो if they
Yeah,
feel, sir, if they feel that कि उसका कम है, तो तुम्हारे पास जो है उसको खुद कम कर लो. कर
true,
लो,
absolutely.
figure it out, and see the previous year question. You will understand what are the important topics and make your own concise notes. Plain and simple. तुम्हारा भी कम हो जाएगा.
And
That's the what I'm
whenever,
remembering.
absolutely, sir, whenever a student asks me now, Dr. Aditya, that what is the best way to check that is my content appropriate or not appropriate? So I simply tell them that first of all, trust the faculty, right? If you don't trust the faculty, then there is no need to be a part of a particular platform, because every faculty is teaching for so long and they have been experienced enough that they know what content is to be given. But anyhow, you might have your doubts. You are individual. You have got all the rights to do that. But then, having said this, if you have a doubt on your notes, whether they are fresh notes, whether they are old notes, not an updated one, whatever app you are using now, make a custom model from that. So if you're reading pediatrics, Make a question paper of 50 questions, 100 questions from that, and start solving it. Now, whenever you are not making a question correct, the answer is wrong. Try to figure out whether that topic is there in your exam, this your notes or no. If the topic is not in your notes and that has been a topic which has been asked in the exam, definitely you need to change the source. You need to adapt to your source. You need to amend your source. It is required. But if the topic is already there in your notes, that means it is your weakness where you have forgotten. If you have not been able to understand the basic or the concept, so you need to work on that. So to just justify the content, give a test yourself. At the end, this notes, these whatever you have made, whatever you have purchased, they should be giving benefit to you, not to me or not to somebody else. Right? You have purchased it with some thought of wisdom or some thought of getting something out of it. So if you're not getting something or anything out of it, it's of no use. So खुद के लिए खरीदा है बेटा, उसको यूज करने के लिए assess it कि आप satisfied हो कि नहीं. जब खुद के ही decision पे doubt करोगे, that means you are never going to get the success. Don't doubt yourself. If you have doubt on your notes, paper deke dekho, test deke dekho. That will be the wonderful idea to check your own notes. All right. So this about the PYTs you just said about how many have to be done for INSET exam, for the NEET exam, FMG. All right. So I think we have covered up broadly all the issues of pediatrics. We can't afford to lose it. A wonderful subject, a straightforward subject. If I know the concept, I can get easily 10, 15 marks edges over any other content. That's a wonderful thing. All right. So, Dr. Aditya, thank you so much for this enlightening session. And now I'm very convinced I can't afford to leave pediatrics. Right. So I must tell everyone Dr. Aditya is using his own workbook that he has created for all the students at FMG segment. And he makes all the students write everything about pediatric in the workbook itself. So you don't have to bring a register in the class. You don't have to bring a notebook in the class where you're missing out images, where you're missing out tables or high yield flow charts. So everything is there in the workbook. With him, you are going to study in the classroom. And once you are making your own notes, that workbook will be your single source for main class notes, for the revision notes, for the rapid revision part, and all your MCQs, whether it is of FMG, of NEET, or INSET, whatever is required to qualify your exam, right? So, Anas, good evening and congratulations. You qualified your exam in 210. We are all so proud of you, right? And we are wishing all our students कि Dr. Aditya ने जितनी बातें बताई हैं follow करो, right? So this is the direct connect with your own faculty of pediatrics. Thank you so much, Dr. Aditya, for sparing out time
Sure.
and enlightening all our
Thank you.
students. Thank you. So बच्चों
Thank you,
पढ़ते
sir.
रहो, stay on the track, and see you all with the next faculty in the direct connect. Another subject, importance of another subject, how to proceed with the subject, and to know your faculty. Stay tuned. See you very soon. Thank you so much, everyone.
Thank you.
Thank you, Manisha. Good night,
Thank you, sir.
everyone.